So first I'm going to introduce myself. My name is Holly Farbo. I am the lead academic and industry relations manager for Hygiene. I work specifically with schools and dental hygiene schools and students, building relationships with them. Um, I am a hygienist. I've been a hygienist for 21 years. I was in private practice for 19 years, and an Aspen Dental was looking for a job, or a hygienist that was very close to me. So I went, and I absolutely loved it. I fell in love with everything that they did there, the culture, everything about Aspen. And so when this job came available, to be able to talk to students and schools and get the word out there about Aspen to new grads, I jumped on board. So here I am now, and that's my story. So Laura, we'll start with you. Go ahead and introduce yourself. Tell us a little bit about yourself and how you got to Aspen.
Yes, my name is Laura. I started, well, first of all, I've been a hygienist since 2006. My first year out of school, I spent subbing, which I hated it at the time because I couldn't find a job, but I loved it because I got to be in so many different dental offices. And it really gave me an idea of what I was looking for a permanent home. I found a private practice I worked at for another year before finding Aspen Dental, and I've been at Aspen Dental for the last 12 years because I found my home.
Wonderful. That's a great story. Riley, go ahead and introduce yourself and tell us how you got to Aspen.
Yeah, so my name is Riley, and I just graduated this year. And so I've been looking for a job. I applied to a few different places, and I actually interviewed with Aspen Dental. And I wasn't quite sure, but I loved the office when I went. And when I did an interview the same day, we went and followed Laura around actually. And I just loved the office and the people in there, and that's how I got started. So yeah, I've been looking for it since. So
Great. Thank you. So first, I'm just going to explain a little bit about what a DSO is. Some people don't know. We use that acronym DSO, and people think corporate dentistry. So it kind of gets like a cold, bad name with that. But what a DSO actually is a dental support or dental service organization. Some people say support, some people say service. And so basically our Aspen Dentals, they're all branded Aspen, but they're individually owned by the dentist. So the dentist would come into an Aspen, buy into a practice, own that practice. Everything is pretty much looks the same in each office. The way that we do our patient flow is very similar. It's all uniform, but patient care has the clinician, the doctor and the hygienist have full autonomy to do the patient care that they see fit. So I work for the dental service part of that, which is Aspen Dental Management Incorporated. So on that end, we take care of everything non-clinical. So an example I always give is if a dentist gets out of dental school and wants to have their own practice, there's several things that are not taught in dental school that they would have to do. So the first thing is finding a place or buying into a practice that's already existing. So that takes money, a financial person to either get a loan or find a place for, so a realtor. A second place is that office location going to be good? You don't know that until you get in there and actually start to see patients. So once you get in there, you're going to have to do all of your payroll. So you'll have to hire somebody for that. You'll have to get your computer system set up. You'll have to hire somebody for that. You're going to have marketing. You're going to have to, if your office isn't doing well and you're not seeing a lot of patients, you're going to have to hire somebody maybe to come on as a partner and give you some advice in that aspect. So there's all these other things other than treatment of a patient that doctors or dentists getting out of school have to worry about once they get into practice. So with us, we do all that for you. So the doctor and the hygienist can focus on patient treatment, and the management side takes care of the rest, marketing, recruiting, all of that. So that's a little bit about what a DSO is. So first question would be, so Riley, obviously you're a new graduate, and I work with a lot of dental hygiene students. So their biggest fear when they get out of school is that they're going to be thrown into a full schedule of patients that they, aren't going to be able to manage. Can you give us a little bit of idea of what your training was like and how that went when you first started?
Yeah, so the first week of training, I followed Laura around for the whole week. And then the second week, she actually followed me around and helped me get through everything. And I had a little bit extra time with each patient just because, coming from school, they give you 3 hours for one patient, and then it's crazy coming into there. But I had a absolute great time. Laura helped me the entire way and gave me extra time for the patients that I needed. So it worked out good.
Great. And even for me as an existing hygienist of 19 years, that training was amazing because,
Yeah.
I undertreated patients, unfortunately, in private practice for a lot of years at different offices. Some offices were great and some, it was like, don't pick up the pokey thing and probe their mouths. So I had a lot to learn too. And so it was a really great training for me. So that brings me to my next question. Laura, I'll direct this to you. Do you have a quota? Do you have a certain amount of patients that you need to see per day?
No. I can make up my own times. I can make up what I feel comfortable with. I actually recently extended my times even a little bit longer just because we now use the iTero machine and we're doing dental health scans on all of our patients. And in order for them to get that correct care, I needed a little bit extra time when we implemented that. So there's no quota or anything like that I can see on my time frame. Obviously, they don't want you to spend all morning doing one person's cleaning, but
Right.
as long as you're within reason, it's very fair, and I can kind of manage my own schedule the best that I can.
Great. So let's get some of the myths and conceptions out of the way with the questions that we have. So number one, no quotas. Number two is that you said that you don't have a set time of amount of time that you need to see a patient. Is that good for both of you, or how does that go?
We typically do it. I mean, Riley and I are pretty similar in how we manage our schedules. It's not like Riley takes 2 hours for a cleaning and I take one. We're very similar in that. So the time frames for the most part are the same for both of us. We like to do our 6-month cleanings, 6-month recall appointments, 2-hour full mouth scalings, and then it varies from there. Hour perio maintenance, things like that. So that's pretty standard for our office, but that's just what we've decided. There's other offices out there that do different times than us, but that's just what we have decided in our own office that works well.
Great. So you guys have a 2 hygienist office. Riley, you're the associate, and Laura, you are the lead. So Riley, as an associate hygienist, what does that look like? What does your role look like as an associate? What does that mean?
So Laura pretty much is in charge of all the ordering and all that kind of stuff. And I just kind of help her throughout the day, and we talk to each other throughout the day. And when we see new patients, we decide who's going to do that. And if she saw the first one, I'll see the next one. We kind of just figure it out as we go. So yeah.
Laura, how about for you as a lead?
Yeah, so like Riley said, I just kind of basically, my role is to drive the hygiene business. So my role is to, make sure that we have the supplies that we need, which sometimes that doesn't happen, but I try my best if we don't run out of things. But then also manage the schedule. So I try to give Riley like a lot of the big bulky stuff, like the scaling and root planings, the things like that. So that way it frees me up to see more of those new patients, because she's going to be stuck there for a couple hours doing that scaling procedure, where I can break away easier than if I'm doing hour-long recall appointments to go see any new patients that may need a perio chart, or a returning patient that may need a perio chart. But it allows me to be able to fill our schedules and manage that a little bit better too. So I guess would be like the managing, figuring out where the pieces go.
Okay, perfect. So some of these questions, guys, you can both answer, or if, I'll try to direct to who I think, it kind of gears towards. So the next question is, we do our new patient exam a little bit differently than a lot of the private practices I worked in. So we talk about comprehensive care, comprehensive treatment planning. So can you go through a little bit of what our new patient exam looks like? Laura, since you do most of the new patients, I think, yes,
Yeah.
go ahead.
So our new patients, when they come in, our dental assistants will actually see them. Well, besides the front desk, they'll be like kind of the first people on hand. They'll take a full mouth series of x-rays at the doctor's orders, of course. But our doctor, when they are a new patient, her expectation is that she has a full mouth set of x-rays. So she would like them done on every single patient, every new patient that comes in. Then they get seated. Obviously, the medical history, stuff like that has been discussed already, but they'll get seated, and then we'll come in as hygienists. We'll do a comprehensive perio chart, take a look at their gum tissue, figure out what the best hygiene treatment would be for them. Then our doctor comes in and does a comprehensive exam, and then she would sign off on what we have treatment planned for the hygiene. Obviously, like, she could disagree because she's the doctor, but I've worked with her long enough where we are on the same page. After the patient has been seen by the hygienist and the doctor, I forgot, there's a dental health scan now with the iTero. Our dental assistant will usually take a dental health scan as well to kind of take a look. That way we have a model to work off of, so that way the patient can see what we're talking about, basically big intraoral camera. And then they sit down with our office manager. The office manager will go over what the treatment is. If the patient has any dental insurance, they'll go over that. If the patient does not have dental insurance, or if they have an existing amount that the dental insurance doesn't cover, we do offer different financing payment options, things like that. And then they get scheduled into the correct schedules, either with the doctor or the hygienist.
Perfect. So if, say, for example, you are treatment planning a patient, Laura, what happens in a two hygiene office if you got your treatment, you disagree on your treatment, pretty much?
Where
is there
me and
ever
Riley disagree, or me and the doctor?
No,
and Riley?
you and Riley. Yes.
I don't think that's happened yet.
Okay.
But I don't know. I told Riley too, there are gray areas. And I told her, sometimes I will think that a patient is a gingivitis patient, or maybe let's go the other way. Maybe I'll say this patient is a prophy, but they really have gingivitis. I get in there, I treatment plan this patient as a prophy. I'll get in and I'll start cleaning their teeth, and then I notice the bleeding and I notice all this kind of stuff. It's like, oh, this probably should have been gingivitis. So I try not to. I always say there are gray areas where it could be right on that borderline where me personally, I may have made that, but I think it's just working as a team and discussing things and be like, when I'm seeing this many 4mm pockets in the perio chart, why, and bleeding gums, why are we putting this patient as a prophy, and just having that discussion. So, but yeah, we haven't really come across a ton of issues yet where we've massively disagreed.
Well, that's nice too. That's part of the support with Aspen, is that you have, that for you to have a seasoned hygienist and a hygienist who's right out of school, is that you it's almost like a mentorship, it's like a mentor. And so key thing, and I tell people this all the time, is communication is very key. And that's what we like to do at our offices. We always say there is no I in Aspen. We're a team. And so the key is communication. We're on the same team. So we're, you don't have to fight for. So this comes to this question. Pay always comes up as far as, what, people think we get paid commission. So first and foremost, do you get paid commission?
No.
I mean, are you based, is your wage based off of commission?
It is not. We are hourly employees.
Right. And so the second thing is, since you're a true hygienist office, can you just briefly, and you don't have to go into the, full of it, but so how does that work with, if you get a bonus, right? How does that work so that you're not fighting for patients? Do you know what I'm saying?
Yes. Do you want me to answer this, Riley?
Yeah.
So with a lead and an associate, both of us get paid a little bit differently with the profit sharing. So Riley gets paid a percentage of what she actually is in her schedule. And so I want to make her schedule great. I get paid a percentage off of what we do as a whole. So of all the hygiene in the office. But on top of that, I also have to pay Riley's wages. I have to pay for my supply. She's like my associate. So her wages come out of that, supplies come out of that. So I have more expenses coming out, but I also want us both to succeed. I want Riley to succeed, so that way she's happy. And by Riley succeeding, it's going to help me succeed.
Exactly. So, that with that hourly rate that you're guaranteed,
Mhm.
you have this profit sharing structure that the way that they have it set up allows you both to succeed. So you want her to do well
Mhm.
because in turn you do well. And it really goes like that with the doctors too. So a doctor coming on is the same kind of structure. It's never wanting to be pitted against each other because it flows so much easier whenever people just, to get along and to actually work for each other instead of
Mhm.
against each other. So Riley, I'm going to ask you this, put you on the
Yeah.
spot here. So when you first came to Aspen, or you first, were going to apply to Aspen, did you have any reservations? I mean, were there any things that you might have been expecting that you were a little bit leery of that you either did or didn't find, like good and bad? We like to be transparent here. So.
Yeah, so when I first applied, I wasn't very sure. I didn't know a lot about Aspen. And like I said, when I interviewed, it was great because I got to follow Laura around and see what she actually does right at the interview. So I thought, hey, they're going to interview me. I'm going to interview them as well, just because
Right.
I know about Aspen. But yeah, I didn't know that Aspen is not like the doctors actually own the office themselves, and Aspen is just pretty much the management company.
Right.
But yeah, like I said, I loved it when I interviewed. I loved the people there, and I'm very happy here. So
Good. So one of the other things that people think of with the DSO is that you're pressured into treating patients, more than they should be treated for. So can you explain a little bit about our system and how we treatment plan our patients?
Yeah. So
yeah,
when they're a new patient, we are doing a comprehensive perio chart from the get go. That was a difference that coming from private practice, I didn't see as much, which I from what I've been hearing, a lot is changing in the private practices with that, but there's still a handful of them that are not changing. But the new patients in private practice were just put into my chair for their cleaning, their full mouth x-rays and the exam. And it was so difficult for me to tell this perio patient that they had periodontal disease, that I could not do just their prophylaxis cleaning, that they needed this deep gum treatment. So it has made it easier for me when I'm coming in to see the new patient to just treatment plan what I know they need. And I don't have to worry about that they're going to be all upset that they're not going to get their 6-month prophylactic cleaning. So with the perio, we know that a certain amount of a percentage of the population has periodontal disease. So when we're not treatment planning that, that's where maybe if you're seeing every single person has a prophylaxis cleaning and a healthy mouth, that's where the questions are going to arise. Hey, are you doing the right thing for the patient? It's never that you have to treatment plan something, you have to do this. They just want to make sure that we are doing the right thing. And that's where it comes down to, doing that. But I've never been forced, or I've never been ever in my 12 years of being here questioned of what are you doing? Why are you treatment planning this person, this person this way?
Yeah. Riley, do you have anything else to say on that?
no, I think she
No.
covered it well.
She did. Let me just go back real quick because I did get a question, and to just clarify this, when you were explaining about wages, so when you're talking about like her wages, Riley's wages, and your supplies and stuff coming out of that,
Mhm.
you're talking about the gross profit sharing,
Yes,
not
yeah.
the.
My hourly wage is very similar to the private practices in the area.
So
So
that
my
doesn't get
hourly
touched.
wage, yep, it's not coming out of that. I am guaranteed the hours that I work. I am guaranteed that pay. It's just, this is in addition to.
Gotcha. So let's go ahead and talk real quick about COVID, because of course that's on everybody's mind. How has your treatment or your patient experience and appointment changed?
Riley, do you want to take that one?
yeah. So for the basic prophies, I'll start with the ultrasonic. That does produce a lot of aerosols. So they want us to try and only use that on the people who truly have gum disease. So gingivitis, periodontal maintenance, scaling root planing, those types of patients, we do wear that, and we're provided the appropriate PPE to wear during those procedures. And then for just a basic pro fee, they want us to try and stay away from the ultrasonic if we can. So we are hand scaling and we are polishing first, just because that does produce a little bit of aerosol. And so we do that first just to allow that aerosol to settle before the next patient gets back here. So yeah.
And Laura, how about before they come in? Is there any protocols that you go through?
Yeah, before they come in, well, we're trying to screen them on the phone. But then of course they have to come in wearing a mask, and then we are taking their temperature as soon as they walk into that door, having them fill out the typical questions, you know, I've been out of the country, things like that. Then if they cannot get called back right away into the waiting room, we're having them wait in their car and then calling them once we're ready to come on in. So then we can go back to kind of normal.
Yeah, hopefully normal soon. So one of the other questions I get, and this is about, you know, do you have to sell products? Like, people think that we end up being salesmen and you have to push products and sell products. Can you, you know, do you feel like you have to sell products?
No, I think it's just what I love about this, and this is going back to private practice too. I just remember we had no products in private practice, and I had to fight for my dentist. I went to a CE on MI paste, and I had to fight for my dentist to just buy me one box of MI paste so I could give it to my patients because I believed in it so much.
Yeah.
And so coming to Aspen, I just feel like there's so many things at our disposal. And you as a clinician can make those calls too. So I am a fan of the Oral-B, and we've actually partnered with Oral-B as a company to give our patients a better price. But I was a fan of the Oral-B before coming to Aspen. So I just like that we have that in the office. I can talk to the patients about the benefits of it. I want them to use the tools that's going to give them the healthiest mouth. But yeah, different products and stuff too. Really, I mean, you're the clinician. You can decide what's best for them, and you can have them at your disposal. So it's just telling the patient what they need. And if you're seeing inflammation in the gum tissue, maybe they need a stannous rinse. Or if you're seeing sensitivity, maybe they need a fluoride toothpaste, a 1.1%. So it just having that in the office, you just have to explain what the patients need. And most of the patients want to use those tools. Patients want a healthy mouth.
Right. So Riley, how do you approach a patient that says, I don't want anything like that? Like, I don't want any of these products. I don't want, you know, I don't want a toothbrush. I don't want anything. Like, what do you say to a patient like that?
I just try to tell them how helpful it's going to be, and just say, you know, hey, this is what I'm seeing. You do have some inflammation. I understand that you don't think you need these, but maybe I show them like their dental health scan that can show the calculus or the inflammation around their gums, and I just try and explain what would work best for them in terms of their overall.
Right. And, you know, what I love too is, you know, I was a hygienist for a long time. And so, you know, I knew a lot of these products, but, you know, Aspen, when I saw the products that were there, the majority of them, they're what I already, like you said, Laura, recommended to my patients. I just had to kind of say, this is what I want, write it down on a sticky note and give it to them, hoping that they would go out and purchase it or be able to find it. It's like, I couldn't find this every time they'd come back. Did you get that? I couldn't find it. I'm like, no, I know that it was there. But I mean, it's so nice to have that on hand to be able to give, because like you, I always loved the Oral-B. So I was so thrilled when I saw that we were partnering with them. And we have Henry Schein as our supplier, and we are their number 2 customer, just behind the U.S. government. So we get good deals. I mean, we pass those on to people. So, you know, how do you talk, Laura, price with a patient? Do you talk price? Do you explain anything like that to them?
When they are a new patient, I don't typically have to, because I know they're going to sit down in a consult anyways. And that is, I think when they're a new patient coming from a patient who's, let's say, for example, they need scaling and root planing, and they've always just had their 6-month cleanings, but I show them the bone loss, things like that. It's kind of nice because I don't really have to discuss those big cost items, but yeah, a rinse, a toothpaste, a toothbrush, things like that, as I'm doing their doing their cleanings, things, I can just let them know the cost. Our system's really nice because it will have everybody's insurance and all their information into the computer, and you can just plug in what you need and it will estimate what the insurance would cover, what it doesn't cover. And I always figure the worst that the patient can tell me is no. So it's like, I'd rather have them know, hey, I'm recommending this fluoride toothpaste. You have a lot of recession and you have a lot of gum sensitivity because of it. It looks like it, without any insurance coverage, it's $33 or whatever it is.
Yeah.
So it's like, if the patient, they will either say yes or no. At least I know I told them, and
Right.
I don't have to keep it a secret.
So one of the things, and of course, you know, and we'll talk about this, is like negative things that are said about Aspen, negative things in general said about DSOs. But sometimes what I see is I see from, you know, former employees or whatever, that my manager, you know, changed my treatment plan, or my manager didn't do this right. How do you approach that? I mean, every office is different. So there's always going to be a different dynamic. There's different employees that work there, just like in private practice. So, you know, it could be a different dynamic. But have you ever come across anything like that? Or have you ever had to deal, and how do you do that? How do you have that conversation with a treatment coordinator or somebody like that might not be presenting your treatment?
Yeah, so I've worked with a lot of office managers in my office. Luckily, our one right now has been there for a couple of years, but usually the bad seeds we don't keep them.
Yeah.
But then the office managers, if I ever do come across where there's a discrepancy or a change, of course, like we were talking earlier, communication is the key. And just to nip it right away and just say, hey, I put this on the treatment plan, I see this got changed or whatever. But I will say that it doesn't happen often, and the ones that do want to do that, they don't stick around.
Yeah.
But then I always say too, it's like, I will tell everybody this, that you take maybe the corrupt other dental office down the road and you times them by 800-900 offices, you're going to have bad publicity. If it's a corrupt dental office or whatever, but there's going to be good dental offices and there's going to be bad ones in the corporate world and in the private practice world.
Correct. Right. So, so Riley, let me get back to the clinical part of this. When you have a patient come in, and this is a question that we always get, who does your x-rays? Do you do your x-rays when you see a patient come in for a recall?
Yeah, so we do the recall appointments, and normally that's just the 4 checkup x-rays, or if they're having issues elsewhere, then we'll take a PA of that as well.
So what other than cleanings and obviously your SRPs and gingivitis treatment, what other types of procedures do you do in the office?
We do Zoom whitening, take-home bleach trays, oral cancer screenings. We partner with our doctor with Invisalign, but obviously the doctor is doing the Invisalign treatment, but we're doing like the dental health scans with the iTero. I'm trying to think, Riley, is there anything else that you can think of?
I don't think so.
I don't think so either.
Yeah, that's another thing that I loved about Aspen, is that I never felt like I really felt burnout, you know. I mean, it was that every day prophy. And honestly, in a lot of the offices, and I worked in Pennsylvania, so I know it's different everywhere, but you know, a new patient would come in, you might get a couple extra minutes for that patient, but you would generally do their x-rays, clean their teeth, and then they would see the dentist. Well, you know, that's really not how it should be done. I mean, the way that we do it with seeing that new patient, not scheduling them for a cleaning, because once you do that, then they don't want to have anything else done, even if there's something wrong. You know, so that was always really nice. So let's go into a little bit about work-life balance. So, and again, we say that all of our offices are owned independently. So a lot of times the doctor has the say, but we are about access to care. So what kind of hours do you guys work?
Riley, do you want to take that one?
Yeah, so we work Monday through Friday. In our office, we actually work 7 to 5 Monday through Wednesday, And then we do one late night on Thursday from 9 to 7. And then Friday, we are open from 8 to 1. But that's for the Granville office. And I have also worked in the Walker office. And they work 8 to 5 Monday through Friday. And then we also are open one Saturday a month. And
Okay, great. So what about a lot of things that the students are very interested in are what we give back to the community. Community dental health is a big thing for the students. So can you go over a little bit about what we do for the communities that we serve?
Yeah, so we do, we have one day out of the year that we do, I think they call it Yes to Vets, but we do free service for veterans. And then veterans can come in as long as if they've served in the military in the past or currently serving. We have done, I've worked every single one of them, and we have given people full dentures. We've done full mouth extraction, then put an immediate in. We've had our lab techs on staff, things like that. And it's pretty rewarding to just see just the care that we can give these vets who served our country. They also do a mission trip. I want to say at least once a year, maybe even more, but
Yeah.
that's for international, is where they'll have a team of people that go together. And what's nice is your expenses are paid by the company for hygienists and dental assistants, things like that. But they'll go overseas and do some mission work. I know our office personally, but it's the doctor's call on that one too. We've had people come into our office saying they need toothbrushes, toothpaste for mission trips, and we can order those extra and then give them to those people so that way they can have that for their mission trips too.
Perfect. One other thing that we do, and I'll mention this, is the mobile mouth unit.
Oh yeah.
And that is a unit that actually we have our own staff that does that. They go around to certain areas. It's like a rock tour. It's like Bon Jovi touring the country, but with our mobile mouth unit. So that is also free service to veterans. And so they have a schedule and they'll stop in certain areas. And then a lot of times, like if it's in your area, the offices will help and volunteer their time for that. So I have a question real quick. So if you don't have a patient, and I've heard that some offices, not our offices, but others do this, which kind of shocked me. But if you don't have a patient, do you have to clock out?
No.
Or do you have to go home early?
There's always things you can do.
Right. So you never have to clock out. You don't get paid
No.
at a lower wage if you're not seeing a patient at that moment. No. Perfect. Well, that's always good.
If you don't have any more patients since the end of the day and you want to leave early, you can, but
Yeah. Well, and that's what I love too, is that, you know, there were times where I'd go in and maybe have two patients. You know, it was a bad day, something happened, and it ended up being my best day because I was able to say yes to the patients that came in as new patients, people who had active infection, and be able to fit them into my schedule. So we never necessarily see that as a downside per se, because it gives us a chance to see the new patients, because when our new patients come in, we don't guarantee that they're going to, you know, have a cleaning, because we have to assess that first. So that's always nice. So, and Riley, I know we talked that you didn't necessarily go through this yet, but another thing is HOP, and that's a part of our training. It's hygiene orientation program. It's part of our training that we do for our new hygienists, and generally we do that like depending, maybe a month or two out. And it used to be where we would send you to Syracuse, or now we have an office or a practice support center in Chicago. But with COVID, I think it's changed and we're doing a lot of that virtually. But Laura, can you explain a little bit about what HOP is and what do you learn there? What's the purpose of that?
Yeah, so hygiene, it's hygiene on the hygiene onboarding program. And when I went, it was in Syracuse, but it's probably a blessing that it's not there because we always get stuck in the snow. But what it would do, I believe this was back in 2008. So I have to try to remember, but I believe it was 3 days, and we were there with a bunch of the new hygienists that started. So it was nice because you got to form bonds with people who were throughout the country. that just started with Aspen as well. But what we learned is Aspen Dental has its own computer system. And I think that's probably the thing that most people fear, is not being able to learn the computer. But they really dug into the computer system. There is a wealth of information on this computer system, reports, resources, things like that. And we just really dug into that. We dug into having conversations with the patients. We role played. They treated us amazing with food. I probably gained like 10 pounds, but yeah, it was a really fun time.
Great. Yeah. So, you know, I was at HOP in 2018 and then 2019 when I went to this job. So I went to Syracuse, and then we opened our new practice support in Chicago. And it was fun because, like you said, you got to meet hygienists from around the country. And so even though Aspen is very large, we have 830 offices, you become this tight-knit community of support. And so that leads me to the bridge. So we have our own intranet that we call it. It's called the bridge. So can you explain to me, you can both give your opinion on this, like what does that have on there and what does that do for you? Do you look at that daily, or, you know, what kind of information is on the bridge?
Riley, you want to take that one?
Yeah. On there daily. So your time clock is on there for you to punch in. And then also your metrics page to see how the whole office is doing overall, as well as there's hygiene resources on there. So all the hygienists over all the offices can get on there. There's like your consent forms, your any hygiene resource forms that you need. There's also a hygiene dashboard on there. So all the hygienists can get on there. If anybody has questions, you can get on there and answer them. So yeah, there's a lot of good resources on there.
Great. So how about CE? Do we offer CE to our hygienists?
Yeah, so what I really like is they give us, it's through Viva Learning, and it's on aspendentallearning.com. So when you are an Aspen employee, you just have to sign up with your work email, and then you get access to this. And this is probably my favorite way of getting CEs, because they'll do live webinars at like 7, 8 o'clock at night. And they're an hour long, and you can jump on there in your pajamas and just watch these webinars. And as long as you watch them live, because they have a presenter and you can message the presenter, they count as a live credit. But they also have them all on demand afterwards too. So if there's a topic that you missed or something like that, it still counts as a CE. They have other things too. That is just my usual go-to one. They usually will have a, pre-COVID at least, we used to always have hygiene meetings about once a year, and in the morning half we'd go over a bunch of hygiene information pertinent to Aspen, and then the afternoon usually would be a CE. So for example, our last one was on the new perio stages and grades, and we had one of our doctors on through Aspen who was certified to do the CE, did that for us. So they have different opportunities. They have different things in our state too, where they'll have one in our capital, you know, and stuff, and everybody can join that one. It's optional. So there's a lot of different options that they give us.
Perfect. Great. So let me go a little bit about, one of the things about Aspen is our support. And we say that all the time. You know, it's second to none as far as any other DSO that I've never worked in another DSO, but I've spoken to people who have. Hygiene gets a lot of support, which it doesn't in a lot of other places. So I'm going to just talk a little bit about the career path, and then I have a question for you guys. So career path here, we have lots of options. One, I mean, my job was one of those, but for the clinical hygienist, the support system goes from territory hygiene manager of support and then division director of supports, hygiene support. So you have a tier of hygiene support that supports offices and around your area. So for your territory hygiene manager, he or she would support several offices in a certain region, and then the division director would support multiple states in that region. So can you tell me a little bit about what your territory hygiene manager does for you?
Yeah, so when she makes her visit, she's very nice. She is never trying to like beat us down. She is our like cheerleader. So she is just like an extra person on our team trying to make hygiene successful. So we welcome her into our office. We're not scared of her by any means. She's a friend. And she will come in and she just wants to make sure that she's supporting us. So let's say, for example, we are having a big problem with getting periodontal treatment accepted. You know, if we are going in there and talking to the patient about needing scaling or root planing, but they're not getting scheduled, she comes in and she wants to find out why. So is it us? Is it us as the hygienist that are we not explaining this the best way that we can? Is it the doctor who maybe is not standing behind it and believing in it and creating the importance? Or is it the office manager where they get into the consult and it kind of falls apart in there? So she kind of figures out and navigates the reasons why maybe a certain thing isn't being accepted, or if your office is doing great, she just comes and claps and cheers you along.
Yeah.
So, but yeah, she's definitely a person that you can talk to with any problems, any issues that you're having. She'll give you guidance. She'll walk you through it. So they're definitely a part of your team.
Yeah. And I know your territory hygiene manager personally, and she's awesome. So
Yes.
shout out to Shannon. Yeah. And, you know, and again, I get that too, because some people will say to me, you know, and I honestly, I worked at one, it was a very small, I guess, kind of DSO type thing that when I went in to fill in the one day, it was like, oh, we have this person that calls from Florida and just basically yells at us and tells us what to do. So, you know, I mean, again, you have these experiences and you get scared. And so when I went into Aspen, I never felt that way. Like, honestly, the support that I got, I mean, you're a teammate. And so everybody wins. When you do well, everybody wins. And so you're all on each other's side, which is really, really nice that you have that kind of support. And for the territory hygiene managers, they're generally, they're people who've worked, most of them at Aspen as a hygienist, that excelled and did well. So they're placed into these positions to be able to support these offices because they've been there and they kind of know. So like you said, she would come in and basically just, he or she, because we do have some men, which I always say she, but you know, I've been a hygienist for a long time, and 95% of hygienists are technically at this point still female, but we have lots of guys too. So, so give me a really quick rundown of metrics. So that kind of scares people sometimes when you say you have these metrics that you have to look at or learn or whatever. So I love the metrics part of it, because to me it was kind of like my own little healthy competition, and you know, to make sure that I was doing what was right, you know, for the patient. So can you explain a little bit about the metrics?
Yeah, so what I really like is on our hygiene metrics page, which basically is just giving you all your numbers. Like, it'll tell you how many oral Bs you have dispensed that that month, how many oral cancer screens you've had. But what I really like is that if you're in like the top of the company in a certain percentage, you are highlighted in green. And if you're in the bottom, you're highlighted in red. So what I'm trying to look at is where I'm highlighted in red, because it's like, okay, well, what am I doing wrong?
Yeah.
And it's not that I need to sell more or dispense more or anything like that, but let's say my fluoride toothpaste, I've been using that a lot of as an example. Let's say my fluoride toothpaste are in red. Well, am I really discussing this to all the patients who truly need it? Or am I just letting this go by the wayside? So there's a lot of little numbers like that where I'll actually do like your actual counts, but it will also tell you your show rate, like how many of your hygiene patients are showing up, how many of your prophies are coming back in 6, 7, or 8 months, how many of your perio patients are coming back in 3, 4, or 5 months. There's a wealth of different things. So that way you can kind of know, like, hey, am I dropping the ball here? Am I, as a hygienist, not being the best that I possibly can? So that's how I use the metrics page. I'm sure other people are like it. I'm competitive. I won't even say that.
I know.
I'm sure other
I
people are competitive.
I am too. So let's, this is a question that, you know, comes up and I've heard it and people are afraid to ask it, but I actually like this question because it gives me a chance to really explain. And once you do that, people understand. So bad press or bad, people saying negative things about Aspen in general. One of the first things I need to say is that Aspen is the largest branded DSO. So there are other DSOs that you may not even know are DSOs because they're not called by the same name. So to me, I think that we have nothing to hide. So I love that we're all called Aspen because it just brings us together under that umbrella. But so and I'll ask you both this, have you come across any negative things said and how do you handle that? So Laura, do you want to go first?
Yeah. I can think of like a specific, well, I've had classmates, from when I graduated even, they'll just kind of, oh, you're working there. And it's just kind of like, yes, I'm working here. I use my own experience of, I worked in private practice. I subbed at plenty of private practices for another year. And what I love about this, and I tell them about the structure is what I love. I love that there's management. I love that there's people above the dentist even. I have been very fortunate to work with really good dentists, but in some of these private practices that I worked for, they're not some of the greatest ones. So I like that I at least had people above the dentist that I could voice any concerns if I ever had to have that, which luckily I have not in my situation at Aspen. But I like the structure with that. And then I'll tell them different positives about Aspen. I like that I can order what I need. I can have this group of people that I can voice different opinions or find out what they're doing. Hey, when you run across this situation, what are you doing instead of being on my own little island? But that's kind of how I combat the negative, is just tell them what I like compared to what I had worked at in the past.
Right. How about for you, Riley? I think she's frozen.
My Wi-Fi is lagging, I think, a little bit.
That's okay. That's okay. If we lose you, we'll just start talking over you. Oh, there she is.
I told like my family members that I'm working for Aspen, and they kind of make like a weird face, like, "Oh, you're gonna work for them." And I love the opportunity just to be able to tell them, this is not they're not what you think they are. Like I go through, we have everything is great at Aspen. It's not what you think it is. So it's just a great opportunity.
And you know what, because you're new, I mean, it's great that you're having a great experience, but you'll get to have more of those experiences down the road so that you can really, you know what I mean? I get passionate about it just because I've been all over the country and I've been all different Aspens. And, the dynamic is obviously different. And, we can't say that in 830 offices that everything runs, like every other office. There sometimes conflicts or there's something that's part of life. That's part of dealing with, whether you be at a private practice or anywhere else, you're going to come across that. So sometimes you just need to know. I always give a life lesson in my lunch and learns that I do students. And, sometimes it starts with you. If you're a team player, if you're willing to help where help is needed, if you're willing to be able to communicate with, it's going to make such a difference in your career. So, and also if you can explain just real quick, and this sometimes lets us understand our patients, what is our normal patient? What type of patient base do we generally see? So what are you seeing on a regular basis?
Yeah, so I see a lot of patients who have just not taking care of their teeth. So it is very different than private practice, but that's what I love about it is the patients I saw in private practice were very good about coming every 6 months for their cleanings. And the ones that I'm seeing here have gone 3 years, 5 years, 20 years. And so it's like they have a lot of broken down teeth, a lot of perio treatment that's needed. Of course, we see our healthy mouth as well throughout the day, but I love the variety because you see everybody, from just had their teeth cleaned yesterday to never. So I do not get bored because my day is filled with a bunch of variety, and it's not just 6 month prophy, a little bit of stain here, a little bit of tartar there.
Right.
So
I'm on a couple dental hygiene job or dental hygiene forums on Facebook. And I see people all the time say, I just started this job and I diagnosed perio, and the dentist was like upset and said, why didn't you clean their teeth? And like was not backing me. And what do I do? And I thought, we don't really have to deal with that. So, sometimes Aspen gets this name where we diagnose peri all the time, but it's because it's there, and it's unfortunate. And I think the tides are finally turning where people are understanding that this is connected to your body. And so many studies that we do, and the AAP guidelines that just change with the staging and grading, we train our hygienists on that. And so I think that some of these private practices that have been under treating for years, they come to us, we give them a full comprehensive exam, and they don't really want to hear it because they've been told that they just were cleaning all their whole time. So, it's like we kind of get the brunt of that, but you know what, guess what? Oh, well, we take it in stride because we know that we're doing right by our patients. I never felt guilty about any treatment that I ever gave to my patient. So, that was always a really nice thing. So, let's see here. Let me see if there's any other questions that came in. Real quick, and I just wanted to ask about this because I know we talked compensation, but I didn't talk about, do you get benefits?
Yes, we do. We get 401k plan, which Aspen Dental provides, and then we also get health insurance, which is pretty good health insurance. And then also they give you, those are two that I mainly take advantage of. The nice thing too is that they have a life insurance plan for their employees that give you your the previous year's salary up to $50,000. So that's pretty nice that you don't have to really provide that for yourself either. They also have different like group plans for car insurance, Verizon discounts, vision, short-term disability, long-term disability, the whole gamut.
Yeah, HSA. So yeah, that's nice because it's something that unfortunately, and again, I'm just speaking from experience, a lot of times isn't offered, the benefits, or it's like, okay, you'll get a lesser wage because we're giving you this benefit package. When you look at the wage that we usually will give, I mean, I always tell people money's not really an issue when you come to Aspen. I mean, we'll work with you. We're competitive. We're going to pay you what the average hygienist in your area is getting paid on top of all these wonderful things. So, that's always a really good thing about, the DSO world, is that we do have a corporation that does our management, so we can offer those kinds of things to our patients. So, my last question, because it's getting, listen, see, we talked and that was great. You guys were talking. I know this time just flew. So I want to be mindful of everybody's time here. We're getting down to the wire. So I'm going to kind of give one last question. Aspen is pretty much about access to care. So a lot of times you'll see our offices that aren't really in right downtown metro areas. We're on the outskirts because of that, because we want to be able to provide that access to care to patients who might not be able to get to an office. Extended hours sometimes, that we have a Saturday a month. Those are all things we do. On the other hand, also, one of our mottos is we're a yes company. So we say yes to our patients. We say yes. So can you give me maybe, Laura, I'll start with you. And Riley, I know you're new, so you may not have, that, but you can kind of give me your experience so far with, how you feel with your career starting off. So Laura, give me a little yes story, what that means to you.
Yeah, so this happens multiple times, but today even, it's just about trying to accommodate the patient. And I knew I had this call tonight, things like that, but our last patient and doctor's schedule was in for a filling, but he was also, he had MS and he was in a wheelchair. And so me being done, I could have just been like, I'm out of here, goodbye. But I saw he was in a wheelchair. He just needed his teeth cleaned. He just had a few teeth on the lowers. It wasn't going to take me that long. So I asked him if he wanted to stay, and he was beyond grateful because he drives over a half an hour away to get to us, plus being in the wheelchair, just having the extra issues and things like that. So he was beyond grateful, and it's basically just saying yes to the patient and almost putting yourself on the back burner sometimes and just saying, I'm going to go above and beyond and just try to get these patients the care that they need.
Right. Riley?
Yeah, so Aspen has just given me the opportunity to be super flexible in my schedule. Like I said, I've worked in the Granville office as well as the Walker office, and a few days in the Muskegon office. So it's really just been a great opportunity for me to see a variety of patients and let them get what they need, the care that they need.
Perfect. I love that. And so giving the culture that we have of coming together as an organization, and that backing that we have, the saying yes to our patients, that's what we got into this job for. Sometimes you lose that kind of passion for the actual reason why people get into any of these healthcare jobs. And so this is part of it. And because Aspen, that culture is so about doing what's right by the patient, it just makes it easy to do. So aside from that, which I loved, my yes story is honestly, Aspen gave me a chance at a career I never imagined. I was a clinical hygienist for a long time. I loved my clinical time at Aspen. It drove me to actually want to continue on with this position to get that word out. But it took me to a career that I never thought possible. So for me, my yes is about yes to my career, yes to being able to expand and reach people that I never thought I would. So I want to thank you guys so much for being here tonight. I really appreciate it. Great talking to you both, and I hope to work with you guys again in the future.
Yes, thank you.
You're welcome. Bye, guys. Have a good
Bye.
night.
Thanks.
Bye.